I'm Chang Hun Ho from Seoul National University, Bundang Hospital. And today I will gonna talk about the basic and clinical application of a laser-powered needleless microjet injector. This one is a brand new one. So maybe most of you never heard about this. Let's start with the first slide. So everybody hates needling, right? But as a dermatologist, we should inject many times. So that's the biggest problem. So, and also, most dermatologic target of the injection is epidermis and dermis, not subcu. But it is not easy to inject exactly dermis. So when we say good injector is, it should be painless, and it should be delivered only to the skin, epidermis and dermis, and we should regulate the precise small amount of the injector, and faster injection is needed for the good injector. So that's why many multiple injector has been developed, like a spring type, or air or gas type, or piezoelectric types. But today, I'm gonna share with you with the laser-powered type. This one is the most frequently used injector, multiple injector. And this one is a mechanical injector named Mesogon. But the speed is a little bit slow. And it might have the needle bend. But this one is the air or gas pressure injector. The advantage of this one is needleless. There's no needle. But the problem is it is very painful. And as you know, 1 shot per second. So it's very slow. And it has a long recovery time. And you can see here, there's a lot of the needle, the fluid loss. So today I'm going to talk about this kind of the injector named the Microneedle. This injector is laser-powered injector, and the amount of solution is 0.3 microliter. It's very small, and interval is 2,400 per minute. And the depth is up to the 2 millimeter, and the pain is very minimal. And the downtime is, it can heal within 3 days. When you compare it with the inlet shape of the Microjet and the air injector, you can see here round and clean inlet. When you do this kind of the laser-powered injector, the benefit is obvious, that the speed is high and the injection volume is very small. And pain is very little and a short downtime. And the dermal target accuracy is high, and the fluid loss is low compared with the airjet or needle injector. So when I say laser-powered, so what is laser-powered? Everybody knows about this kind of the graph. So this is absorption coefficient curve of the water. You know, the erbium YAG laser is the highest absorption curve. So when you irradiate erbium YAG laser onto the water, it is exploded. And this explosion makes some pressure, very tiny pressure. We should use this kind of very tiny pressure. So this system has a two-chamber system. The upper water chamber and the lower drug chamber. Between them, there's a membrane. So explosion is made into the upper water chamber, and the tiny pressure is made, and that pressure pushes down this membrane to down. And then the drug is micro-jetted. So time interval between the explosion and the microjet formation is 100 microseconds. And speed of the fluid is, average speed is 350. This system has a three combination system. The first one is a laser. Currently, the erbium YAG laser is used, but we can use the Q switch or the other kinds of laser. And then handpiece and this nozzle. This nozzle is a disposable nozzle. There's three types of the nozzle size, so 150 and 200 and 250. The original idea comes out about 10 years ago, but with many development, with the IP protection, and then final products is coming out. So we have tested onto the animal skin and the gelatin, and when you test it on the mini pig, you can regulate the depth of the injection by the power. And then when you see the ultrasound image onto the human skin, you can see the small bubble is inside. This is the OCT image from the top view. You can see the fan-shaped injection is made. And the temperature is very important. Temperature into the drug reservoir is very important because most of the drug, some of the drug is protein-based. So if the drug reservoir temperatures go high, the protein is denatured, including the botulinum toxin. So we measure the temperature with many injections. So always the temperature is below 40 degrees. So we have tested many kinds of the injection material, including HA, vitamin, and botulinum toxin, PRP, PDRN, and growth hormone, and insulin. And we have tested it onto the many kinds of the indications. Two basic techniques can be used for this drug delivery system. The moving technique, like this one, or stacking technique. Stacking technique means stay one side and getting the several shots in one side. You can see on the gelatin that this is a moving shot. This is a stacking shot. You can see when you do the stacking shot, it makes a more deeper injection. This is skin changes after injection. Moving shot 10 hertz, moving shot 40 hertz. 40 hertz means 40 shots per second. It's very fast. This is the first article published on the clinical anatomy. This test is done in the cadaveric skin. You can see HA is injected into the cadaveric skin. I was one of the co-authors of this article. And when you treat it with stretch mark, it is greatly improved after the injection with the HA. This is the second article. It is published just last month, August. So I was a co-author of the corresponding author of this article. We used the PDRA with this drug delivery device. And then we compared with the manual injection, needle injection, and this kind of the laser-powered injector. And the effect is very similar. The skin tone increased, and there's some anti-aging effect, both of the treatment. But the treatment time is greatly decreased with this kind of the laser injector. And one more thing is the pain visual analog scale is very low compared with the manual injector. And also, you can see here, bruise is very little compared with the manual injector. When you see this picture, the laser-powered injector side and the control side, you can see here, it is very easy to make these kinds of the bruising after the injection manually. But if you use these kinds of the laser-powered injector, it makes a constant depth and a constant micro Z, so it diminishes the making this kind of the bruising after the injection. And I will show you several of the before and after photos. So this one is the first patient in the world with using this injector. This man is the CEO of this injector company. And I have treated with botulinum toxin onto the left side. So you can see a little bit improvement compared with the right side. But you should keep in mind, just one side is a 0.3 microliter of the botulinum toxin. Very tiny volume. So that's why it has a little effect, but compared with the right side, it is improved. This is my forehead. So I treated with the glabellar area with this device with the stacking shots. So it has been improved after 3 days. So nowadays, we use this technique with a non-contact moving technique. We call it a soft moving technique. It can be used for the pigmentation and the rejuvenation. You can see here, if we treat it with vitamin C, it can show the improvement of the pigmentation. And if you see using some other products, you can see improvement of the melasma here. Another shot of the melasma after 2-month treatment. This is a PDRA treated with PDRA, and you can see the anti-aging effect. And one more important indication is the depressed scar. When you check with this kind of the depressed scar, it can be treated nicely with this device. And depressed acne scar also can be treated with PDRA. Here's another before and after photos of the depressed scar. And here's another photo. You can see the greatly improved. And this kind of the elevated hypertrophic scar can be treated with the triamcinolone. Here's another picture of the depressed acne scar. So another shot. So nowadays, one of the biggest indications of this system is stretch mark. A lot of women have this kind of stretch mark after birth, delivery of the baby. And when we treated the stretch mark, we use the stacking shot and the moving shot together. This one is a stretch mark on the hip. You can see, greatly improved. Another stretch mark on the leg. Another stretch mark on the breast. you can see huge improvement after treating. So nowadays we are adapting to the scalp injection technique. We use the ATP. ATP is basically, it is like the fuel of the cells. So if you give the energy to the cells, it can make more thicker hair. So after the treatment, it might be shows somewhat effective with treating. So this is a comparison table, and this might be the final slide. And as I concluded that this kind of laser powered the injector can make a small amount of injection, and it is very fast the injection, and it is a minimal pain and a quick return to it can make a quick return to daily life, and then it can inject it onto only the dermis or epidermis. So thank you for your attention.